Herr Dr.
Dr. Nedjat, how did you come up with the smart grinder method?
It was at the most important French Implantology Congress in 2016 in Nice, Neuroimplanto, where I was invited as a speaker on the MIMI procedure. My direct predecessor was Professor Dr. Itzhak Binderman from Tel Aviv University. His presentation as the developer of the smart grinder procedure was, for me personally, one of the most important and best conference contributions in the last 30 years. I immediately invited Itzhak to a VIPSM Congress in Mainz, where he impressively explained the procedure to the German-speaking dental community.
What was so impressive about it?
You see, teeth and bone are almost identical in structure. Simply put, using properly ground and sized tooth material, you get 100% optimal lamellar bone. And the fact that tooth material contains far more bone growth factors than bone itself makes biorecycling of non-preservable teeth even more interesting. Every tooth extraction leads to a volume loss of 3 to 6 millimeters in width and 2 to 4 millimeters in height within the first 2 to 6 months after tooth removal without socket preservation.
How long does it take from tooth extraction to reuse?
Normally, a certified dental professional, right before the patient's eyes, removes all foreign materials like amalgam, plastics, cements, and root canal fillings in about 3 minutes. Then, the remaining tooth is dried, placed in the disposable chamber, and within a few seconds, it is ground and sieved. The material is then transferred into a Dappen dish, treated with the cleanser fluid for 5 minutes to ensure no bacteria, viruses, or fungi are detectable. The cleanser fluid, with a pH of 11.4, is then neutralized by shaking the Dappen dish twice for 5 seconds with the buffer fluid, bringing it to a pH of 7.1. This process takes only 8 minutes in total before it is placed back into the tooth socket. It's also important to note that we only place the ground tooth material in the crest of the socket and secure it with a blood stop dressing.
Can the entire tooth actually be reused? And are there any complications or risks of inflammation?
Yes, both the enamel, dentin, and root cement are ground and processed together. Even endodontically treated teeth can be biorecycled. Since it's cleaned but autologous material, there are no immunological inflammatory reactions. Both the dental team and the patients are absolutely thrilled with this affordable, quick procedure that offers the best possible socket preservation.
How long can the remaining material be stored? And what are the other indications for using smart grinder material?
The material can be stored dry indefinitely. The only important thing is that it must come from the same patient due to genetic compatibility. Material from another patient should not be used. Therefore, we provide the grinding chamber with the remaining material labeled with the patient's name. In addition to regular socket preservation, sinus lifts and lateral augmentations are also excellent indications for using SG material.
Is the bone substitute material sufficient for all cases?
Yes, because when we grind the tooth material to the specific particle size, its volume triples.
Are there any long-term scientific studies on the smart grinder method?
Oh yes, leading universities and research institutes worldwide, including 2 in Germany, have conducted histological studies on this. To my knowledge, it is the only material that actually transforms into autologous bone. It is superior to both bovine and synthetic bone replacement materials and is also significantly cheaper. Just check out the impressive scientific publications on the cometabio.com website.
What is your conclusion about the smart grinder method?
Those who don't know about it will miss out. You know the Sesame Street song? The message is, this little tabletop device from Cometabio is a must for every dental practice that extracts or osteotomizes adult teeth. It should be used after every extraction to prevent alveolar collapse, regardless of whether the patient will be treated later with a bridge or implant.
Is there information available for patients?
Yes, the VIPism offers free patient flyers and also the very popular patient education video for dental practice websites.
Can the device be tested with patient kits? Where can the products be ordered? And how much does the smart grinder cost?
Yes, for a maximum of 3 months, you can rent the smart grinder for testing in your practice with our satisfaction guarantee. Champions Implants has the exclusive right to distribute Cometabio products in Germany, Austria, Switzerland, and France. You can either order through our online shop or call us at +49 6734 914080. Currently, we have an offer. The tabletop device costs 1890, which includes 6 patient kits at 65 fils each, including disposable grinding and sieving chambers, as well as cleanser and buffer liquids and Dappen dishes. 1 chamber per patient should be used, and you should not reuse them. Typically, in a private practice with an annual turnover exceeding 30,000 euros, the device pays for itself within just 1 month of use. In an average practice extracting 220 teeth per year, patients are charged 175 to 250 euros immediately after the procedure, with material costs of only 65 euros.
If not immediately implanting, when can implants be placed after smart grinder use?
For immediate implants, the implant should be placed first, followed by filling the remaining socket with smart grinder material. For delayed implants, the material should be placed and implantation can proceed starting from the 8th week post-op.
Thank you for the informative discussion.
Ich
Danke dir.